is Impossible Papa. Today we are going to discuss more about malnutrition. Malnutrition is a significant global health issue that affects millions of people, especially in developing countries like Malawi. So it occurs when a person's diet does not provide enough nutrients for growth and maintenance, or when they are unable to adequately use the food they eat. So today I have joined by a guest who will give us more information about malnutrition. So I welcome you in this podcast.
Thanks.
Thanks, and just ask you to introduce yourself.
Okay, my name is King Sebinga. I'm doing public health in degrees.
Okay, fine.
Yeah.
So what is malnutrition?
Malnutrition, we are talking about your body needs a variety of nutrients and in certain amounts to maintain its tissues and its main function. Malnutrition happens when the nutrients it gets don't meet these needs. You can be malnourished from an overall lack of nutrients, or you may have an abundance of some kinds of nutrients but lack of other kinds. Even the lack of single vitamins or minerals can have serious health consequences for your body. On the other hand, having an excess of nutrients can also cause problem.
Yeah.
Yes, that's all.
Okay.
Yeah.
What are the types of malnutrition? Because I have heard that there's a lot of types.
Yes, there's a lot of types, almost 4. Yeah, there's 4 types. First type of malnutrition, we are talking about undernutrition. Yeah, when you're talking about undernutrition, is what most people think of when they think of malnutrition. Undernutrition is a deficiency of nutrients. You may be undernourished if you don't have an adequate diet.
Yeah.
Or if your body has trouble absorbing enough nutrients from your food. Undernutrition can cause visible wasting of fat and muscle, but it can also be invisible. You can be overweight and undernourished.
Yeah.
Yeah. Another types of malnutrition is micronutrient, also called protein energy malnutrition.
Yeah.
This deficiency of micronutrients, we are talking about proteins, carbohydrates, and fats. Micronutrients are the main building blocks of your diet. The nutrients that your body relies on to produce energy to maintain itself.
Yeah.
Without them, or even just one of them, your body soon begin to fall apart, breaking down tissues and shutting down non-essential function to conserve its raw energy.
Yeah.
Yeah, more to that, eat micronutrients under nutrition or under malnutrition. Micronutrients are vitamins and minerals. Your body needs this is smaller, or your body needs this in smaller amounts, but it does need them. For all types of function, many people are middle deficient in certain vitamins and minerals from lack of variety in their diet.
Yeah.
Yeah, you might notice a middle vitamin deficiency affect you. But as micronutrients becomes more severe, it can begin to have serious and lasting effects.
Yes.
Overnutrition is also types of malnutrition. The World Health Organization has recently added overnutrition to its definition of malnutrition to recognize the detrimental health effects that can be caused by excessive consumption of nutrients. This include the effects of overweight and obesity, which are strongly associated with a risk of non-communicable disease. It also includes the toxicity, which is toxicity, that can result from overdosing specific micronutrients. Moreover, in micronutrients, when your body has an excess of proteins, carbohydrates, or fat calories to use, it stores them away as fat cells in your adipose tissues. But when your body runs out of tissues for storage, the fat cells themselves have to grow. Enlarged fat cells are associated with chronic inflammation and with a host of metabolic disorders that fall. This can lead to NCDs such as diabetes mellitus, coronary arteries disease, and stroke. The last type of malnutrition is micronutrients overnutrition. You can actually overdose on vitamin and minerals supplements. More research is needed to explain how this happens and how much is too much of certain vitamin or minerals. In general, micronutrients overnutrition is uncommon and doesn't occur from diet alone. But if you take mega doses of certain supplements, it can have toxic effects. It's a good idea to check with your healthcare provider first. That's all about the types of malnutrition.
You have explained very well about the types of malnutrition.
Yes.
So, who does malnutrition affect?
In its broadest sense, malnutrition can affect anyone. Lack of knowledge of nutrition, lack of access to variety of foods, sedentary modern lifestyle, and economic disadvantage are all common contributors to malnutrition. Certain populations are more at risk of certain types of malnutrition. Yes, that's all.
What are the populations more at risk of undernutrition?
Can you pardon the question?
What are the population more at risk of undernutrition?
The first population more at risk of undernutrition is poor and low income. Whether in a developed country like the US or in a developing country with fewer resources overall, poor communities have less access to adequate nutrition. Yes. Second one is children. Children have greater nutrition needs than adults in order to grow and develop. Disadvantages children are especially at risk of undernutrition and its consequences. The third one is chronic illness. Many chronic illness can directly affect appetite and calorie absorption. Some increase your calorie needs. Spending time in the hospitals is also at risk factors of undernutrition. The last one is elderly. Elderly, as adults, advanced in age, their nutrition can deteriorate for several reasons, including reducing mobility, yeah, institutionalization,
Yeah.
reduce the appetite, and reduce the absorption of nutrients. Yes, that's all.
Okay.
Yeah.
What are the population more at risk of overnutrition?
Okay. Yeah. Can you pardon your question?
Okay. What are the population
Yes.
more at risk of overnutrition?
Okay. We have population more at the risk of overnutrition, and these are poor and low income.
Yeah.
In developed countries, poorer communities often have easier access to fast foods,
Yeah.
which are high in calories but low in nutrition value. Yeah, then they have to nutritious whole foods.
Yeah.
This can lead to micronutrients overnutrition with micronutrients undernutrition. And lastly, sedentary, desk jobs, family obligation, health and social factors that keep people sitting all days instead of out and moving about can lead to significant weight gain.
Okay.
Yes.
So what happens to the body during malnutrition?
Micronutrients undernutrition, or protein energy undernutrition deprives, or some says deprives, but to me I'm saying deprives your body of energy to sustain itself. To compensate, it begins breaking down its own tissue and shutting down its function. This begins with its body fat, so, and then proceeds to muscle, skin, hair, and nails. Yeah, people with protein energy and nutrition are often visibly emaciated. I can say so.
Yeah.
Children may have stunted growth and development. One of the first systems to begin to shut down is the immune system.
Yeah.
This makes undernourished people highly prone to illness and infection and lower to recover. Wounds take longer to heal. Cardiac activity also slows down, leading to lower heart rate, lower blood pressure, and lower body temperature. People may feel faint, weak, and apathetic about life.
Yeah.
Yes, they may lose appetite, and parts of their digestive system can atrophy. Secondly, people who have micronutrients undernutrition are likely to also have micronutrients undernutrition. Yes, when overall calories are lacking, that affect vitamins and minerals levels too. Some of the complications of severe undernutrition condition, such as marasmus, kwashiorkor, resulting from particular vitamin deficiency. For example, vitamin A deficiency can cause vision problem. And vitamin D deficiency can cause soft bone. Yes. And lastly, some people may consume a lot of calories, but not enough vitamins and minerals. In these cases, the effects of malnutrition may be less obvious. People may be overweight from micronutrients overnutrition, but may have symptoms of anemia, weaknesses, faintness, and fatigue. Due to the lack of minerals or vitamins, people who have overnutrition may show symptoms of metabolic syndromes, such as insulin resistance and high blood pressure. That's all about your question.
Oh, thank you.
Yeah.
So, what are the signs
Yes.
and the symptoms of malnutrition?
Okay. Undernutrition may look like low body weight, prominent bones, depleted fat and muscles.
Yeah.
Yes. Thin arms and leg with edema. Or we are talking about swelling with fluid.
Yes, yes.
Yeah, in your belly and face. Stunted growth and intellectual development in children. Weakness, faintness, and fatigue.
Yeah.
Irritability, apathy or inattention. Dry, inelastic skin, rashes, and lesion.
Yeah.
Yeah. Brittle hair, hair loss, and hair pigment loss.
Yeah.
Yes. Frequent and severe infection. Low body temperature, unable to get warm.
Yes, yes.
Low heart rate and blood pressure. When talking about overnutrition, might looks like those things we have talking about undernutrition, but now we have talking about overnutrition.
Yeah.
Yeah, might looks like obesity, high blood pressure,
Yeah.
insulin resistance, heart disease. That's all.
Oh, okay.
Yeah.
So, I wanted to know,
Yes.
what are the causes of malnutrition?
Undernutrition is usually caused by not eating enough nutrients. It can also be caused by certain medical conditions that prevent your body from absorbing nutrients.
Yeah.
You might have trouble getting enough nutrients if you have one, limited financial resources.
Yes.
Two, we have talking about limited access to nutritious food.
Yeah.
We have also talking about medical conditions that make eating difficult, such as nausea or difficult swallowing. Yeah, four, we have talking about the medical conditions that deplete calories, such as chronic diarrhea or CAS. Fifth one, we have talking about an extra need for calories, such as during pregnancy or breastfeeding or childhood.
Yes, yes.
Sixth, we have talking about the mental health condition that discourage eating, such as depression or dementia.
Yeah.
Another one, which is number 7, we have talking about eating disorder, such as anorexia and bulimia. Eighth, we have talking about malabsorption. Yeah, disorder. Malabsorption disorder, such as pancreatic insufficiency or inflammatory bowel disease.
Yeah.
And then if you have talking about a condition that require long-term intravenous feeding. Rest we have talking about a very restricted diet or an appealing diet chosen by someone else. Yeah, that's all about undernutrition. But now we are also talking about overnutrition. Yes. Yeah, overnutrition is caused by consuming more nutrients than you need. You might do this if you have first, few nutritious food options. Secondly, we have talking about a sedentary lifestyle. We also talking about a condition that slows down your metabolism, such as hypothyroidism. We have also talking about a hormone imbalance that interferes with your hunger and fullness signal.
Yes.
We have also chronic stress, also anxiety or depression. We are also being, I don't know that if it is sure, but being eating disorder.
Okay.
Yeah, and last we have talking about chronic overuse of dietary supplements. That's all.
Oh, fine. So, how is malnutrition diagnosed?
Can you pardon?
How is malnutrition diagnosed?
Okay. Physical observation. We can diagnose by using physical observation.
Okay.
And the history of your diet and the health condition are often enough to diagnose protein energy, undernutrition or overnutrition. A healthcare provider may measure your BMI or measure a child arm circumference to help understand the extent of the problem. If possible, they will take a blood sample to test for specific micronutrients imbalance. Micronutrients and nutrition often accompany micronutrients or undernutrition, and it can accompany micronutrients overnutrition too. A blood test will also diagnose the rare case of micronutrients overnutrition if you have those symptoms.
Okay, so how is it treated?
Okay, in undernutrition is treated with nutritional supplements. This might mean individual micronutrients, or it might mean refeeding with a custom high calorie nutrition formula designed to restore everything your body is missing. Severe undernutrition can take weeks of refeeding to correct, but refeeding can be dangerous, especially in the first few days. Your body changes in many ways to adapt to undernutrition. Refeeding asks it to change back to its old way of operating, and sometimes that change is more than it's prepared to handle. It's best to begin refeeding under close medical observation to prevent and damage the complication of refeeding syndrome, which can be serious and even life-threatening. When talking about overnutrition, it's generally treated with weight loss, diet and lifestyle changes. Losing extra weight can help reduce your risk of developing secondary conditions such as diabetes and heart disease. Weight loss treatment may include diet and exercise plans, medications, or medical procedure. You may also need to treat an underlying condition such as thyroid disease or mental health disorder. Weight loss can also be rapid, or it can be long and gradual, depending on the path you take. But after you lose weight, it's the lifestyle changes you stick with that will help keep it off. This may involve long-term support system such as counseling, behavioral therapy, supporting groups, and education in nutrition. That's all about your question.
Okay.
Yeah.
How do we people
Yes.
prevent malnutrition?
Malnutrition is a global problem in both the developed world and the developing world. Poverty and lack of understanding of nutrition are the leading causes.
Yeah.
We can help control the disease of malnutrition with better worldwide education and support for the disadvantages, including access to clean water, nutrition, whole foods, and medicine. Children and elderly who may not be able to advocate for themselves are especially risky and may need closer attention paid to their diet and health condition. The best way to prevent malnutrition is to eating a well-balanced diet with a variety of nutrients, whole foods in it. If you have enough of all the nutrients your body, or if you have enough of all the nutrients your body needs, you will be less likely to overeat trying to satisfy those needs. Some micronutrient deficiencies are common even with a fairly standard diet. A blood test is one way to find out if you could benefit from micronutrient supplements. Your healthcare provider can help you determine the correct dose to take. That's all.
Okay. What is the prognosis for people with malnutrition?
Malnutrition is treatable, but some effects can linger. Effects of severe undernutrition, such as blindness from vitamin A deficiency, soft bones from vitamin D deficiency, and stunted growth from protein energy and nutrition in children may not be reversible even after rehabilitation. Secondly, effects of long-term overnutrition, such as insulin resistance and carotid artery disease, may last even after weight loss. However, with area intervention and good follow-up support, people can make full recovery.
Okay.
Yes.
So when should I see my health care provider about malnutrition?
Contact your health care provider if you have recently lost or gained more than 10 pounds unintentionally. You have symptoms of anemia such as weakness, faintness, apathy, and fatigue. You think you might have an eating disorder. You suspect child or elder abuse or neglect in your community. Yes.
Okay. So this is marking off our discussion for today.